city of Milwaukee and the state and the National Guard to help us bring more testing to our residents. The National Guard will be setting up and staffing 2 Milwaukee sites for on-the-spot public testing starting next week, Monday, May 11th. The north side location will be at Midtown, located at 57th and Capitol in that parking lot. And the south side location will be at UMOS, located at 2701 South Chase in their parking lot. You can walk up, you can drive up to the site, but you do not need an appointment. Anyone can get tested whether or not they have symptoms. However, we are especially encouraging people who have symptoms to come. It is very important that you get tested if you have the following symptoms: fever, cough, shortness of breath, chills, headache, sore throat, loss of sense or smell or taste. The National Guard will be on site from 8 a.m. to 8 p.m. 7 days a week. They will not be in uniform, rather in scrubs and in protective gear. They will have the ability to do about 500 tests a day at each site, so it's about 1,000 total. Specimens will be transported the same day to the lab Exact Science, and the goal is to have the results to the patient within 3 days. It will be extremely important that everyone who tests positive self-isolate. If you do not have the ability to self-isolate safely, there are resources to help. So we're asking you to call 211 if you need to. Our local health departments will be doing contact tracing for anyone who tests positive. If you do test positive, it is very important that you respond to these contact tracers so they can find out who else may have been exposed to the virus and notify them as well. We especially want to encourage essential workers and frontline workers to get tested. These include, again, healthcare workers, grocery store workers, transportation workers, food processing workers, other people who work in assembly, manufacturing, and other facilities that are currently operating. If you have symptoms, please do not take public transportation. Please remember to wear a mask when you go out in public to protect yourself. Testing is the key to flattening the curve. This special testing event with the National Guard will allow us to get a better understanding of the infection rate here in Milwaukee. We need as many people as possible to get tested. So testing is extremely important. That's something that we all need to remember, especially if we have symptoms. So I want to say thank you, and then hand it back over to Brian.
Thanks, County Executive Crowley. Next, we'll hear from Dr. Ben Weston, who's the Director of Medical Services for the Milwaukee County Office of Emergency Management.
Thanks, Brian. Good afternoon. First to the numbers, we have 3,810 confirmed cases of COVID-19 in Milwaukee County and 206 individuals who have died. I wanted to take a moment today to talk about testing in a bit more detail, what types of tests are out there and why it's important to understand some of the details about them. There's 2 main categories of COVID-19 tests that you'll hear about: antibody tests and PCR tests. So briefly, antibody tests are blood tests. They look for antibodies that our body produces to fight COVID-19 infections. These tests would be performed after complete recovery from a COVID-19 infection to understand who's been infected and potentially has immunity, and who has not been infected and does not have immunity. The promise of antibody tests is substantial. We could theoretically know who's been infected and who's immune, and therefore no longer has to worry about COVID-19 infections. The challenge with these tests is twofold. First, due to lax regulation and lax oversight, there are many tests out there, nearly 100 different versions with a variety of levels of accuracy. So you very well may have a positive result for having antibodies, but that result may be more likely to be inaccurate or a false positive than it is to be accurate or a true positive, worse than the flip of a coin. The second problem with antibody tests is that we just don't know yet how much immunity people get from COVID-19 infections. While some diseases confer a week of immunity where you can't be reinfected, others provide years or even decades. We presume COVID-19 provides some level of immunity, but we just don't know yet how much. So antibody tests have promise and they have a place, but we're just not there quite yet. But there will be more to come on that front. PCR tests are the ones with which we're more familiar. These are the tests to see if a person has an active COVID-19 infection, typically through a swab in the nose. These tests look for genetic material of the virus. There's a variety of types of these tests as well, and some are better than others. So while a positive result of these tests is fairly reliable, a negative test may be less so. So a false negative test which can occur at times, may be due to a variety of factors. It might be that you're infected, but you just don't have enough virus in your system yet to test positive. It may be that the swab wasn't sufficiently done to collect enough virus to be detected. Or it may be that the test itself, by design, is not as sensitive at finding the virus material. Either way, the take-home point with these tests is that while they're critical to identifying individual people with COVID-19 and to understanding the burden of disease in our community and to deploying containment resources now and in the future, we have to remain aware and conscious of the meaning of the test result. Occasionally, someone with a negative test may be in the early stages of the virus and potentially still be contagious to others. And most importantly, a negative test does not mean that you can't get infected in the future, even that same day that you receive a result. We must continue to distance from others to prevent the spread of disease regardless of the result. The PCR test that we're currently offering at 17 healthcare locations around the county, and also what the National Guard will be offering next week. By calling 211 and following prompts by entering your zip code, you can be referred to a testing site near you, regardless of insurance status, income, or immigration status. Thank you and stay safe, and I will hand it off to Dr. Bhattacharya.
I think we may be having, Dr. Bhattacharya may be having trouble connecting at the moment. Dr. Bhattacharya, are you with us? Okay, so while his team is working on helping him get connected, the next person that I have on our agenda to start telling us about the active streets is Mayor Barrett. And I'm not sure if Mayor Barrett is with us either. So while we wait for the two of them, we can move on to Jen Francis, who is the interim executive director of the Milwaukee County Parks, who can tell us about the Active Streets program. I'm sorry, and Director Francis, you are currently muted if you can take yourself off mute.
All right, thank you so much, Brian. I appreciate the chance to be here again today. Well, we're really excited today to announce the launch of our Active Streets partnership, Milwaukee Active Streets, with the City of Milwaukee and Milwaukee County Parks. This is a initiative that has started as a result of the COVID-19 pandemic and been implemented across the country, providing relief for community members who are outdoors recreating. And so it's a means to close down temporarily streets that are near parks properties or connective spaces that pedestrians most commonly use, to shut those off from vehicular traffic and open them up for pedestrian traffic. We're really excited about this partnership. We've been spending time making plans and have a lot of details we can share today. I'd love to turn it over to County Executive David Crowley for a moment to give a little bit of intro about it, and then I'll follow up with some more details.
Great. Thanks, Jen. So we are excited to launch the Active Street partnership with our friends at the City of Milwaukee. While we have asked our residents to stay home and eliminate unnecessary travel under the Safer at Home order, we want to encourage people to get outside and encourage them to engage in physical activity near their home. So our message remains to really enjoy our open spaces, to walk in them, and don't drive, especially during this time. And so we know that outdoor time and physical activity are essential to maintaining health and well-being during this unprecedented time of this pandemic. So the Milwaukee Active Streets will give us a way to really temporarily provide more space for pedestrian use. The county selection was based off which parkways had no access in residents or businesses and were possible to close, which areas have few parks or trails or could use additional space for exercise, or where overcrowding was occurring or likely to occur. So the active streets are not meant for games, socializing, congregating, or stopping any of these activities. We want to continue to support social distancing. So we want to make sure we're adhering to the Safer at Home guidelines, but we want to make sure we're continuing to partner with community organizations and neighborhood groups to build awareness of this initiative and ensure compliance of people driving and document success and lessons learned.
Great. Thank you, County Executive David Crowley. I'll share just a little bit more detail about the program, and then we can have questions later. But we're really excited to partner in this effort with the city of Milwaukee and potentially other municipalities within the county as we dig in. We clearly have seen that there's more interest in getting outdoors these days, and the city of Milwaukee has seen a 45% increase in trail usage over the past couple of months compared to this time last year. The county has also experienced similar increases, and these numbers are only expected to increase as the weather warms. And so we know that in many neighborhoods, outdoor space is limited, parks, trails, and sidewalks can easily become crowded, and it makes it difficult to maintain the recommended 6 feet of physical separation. Milwaukee Active Streets will limit motor vehicle traffic on roughly 10 miles of streets throughout the city and in county parks as a pilot program, converting them for pedestrian use rather, and closures will be phased in over the next couple of weeks. The county park locations that we're really excited to be rolling out today actually are at Jackson Park, Humboldt Park, and Little Menominee Parkway. So at Jackson Park, the impacts are between, it's basically a closure from 43rd Street to Forest Home Avenue. At Humboldt Park, it's South Howell Avenue to East Oklahoma Avenue. And on the Little Menominee Parkway, it's Appleton Avenue to Mill Road. ADA parking spots will be signed and marked at all 3 of these county active street locations. Active streets within the city will be open to local traffic only once those get rolling, and they'll be signed and barricaded, conveying that information. Active streets running through the county parks are a little bit different in that they'll be closed to all through traffic, but they will be open to emergency vehicles and park staff as well. If you live on a designated active street, you will be able to drive on your street and park on the street as you normally would. Parking will not be impacted. Additionally, emergency vehicles and deliveries will also have access to the streets as needed. City DPW staff and county park staff will be monitoring the active street segments, and we are also seeking volunteers who are willing to monitor segments themselves. We ask that all drivers who must use an active street drive with awareness that they slow down and be cautious of pedestrians. Anyone seeing dangerous behavior should report it, and if necessary, call 911. As the mayor mentioned, as the county executive mentioned earlier, if we are successful, we are interested in identifying future active street locations within the city and the county to expand the offerings. We want to hear feedback as to how it's going. So for more information on city and county locations, detailed FAQs, or to sign up to become a volunteer, you can visit milwaukee.gov/active streets. And we'll have that information. That website is also available on the parks website, and it will be broadcast at the end of this as well. Do we want to pause to take any questions on active streets specifically?
Sure, we can do that. Any questions on active streets? Here's one from Jeremy Janine for County Executive Crowley. With creating space in the parks, will more be done to prevent groups from congregating? Playing contact sports like soccer, or using picnic tables, or playing tennis, or things of that nature?
So I think that when you look at what has been happening in our parks, many people have been doing their best to adhere to the social distance guidelines. So we're not looking to necessarily break up things. We know that things have happened as things get warmer, but we think that pushing active streets and really having this available will give people the opportunity to do a lot more than just going to the park. So we don't want people to engage in activities that does not adhere to the safer at home guidelines or the social distancing guidelines. So we're going to do again everything that we can to promote safe activities throughout Milwaukee.
And if I could help answer that too, thank you for that. We're on board here. And I think the object of active streets is for continuous movement. So it's not about, as County Executive David Crowley mentioned earlier, it's not about pausing and stopping and, picking up a game in the street. It's about moving through spaces. And that's going to be a message you hear over and over this summer. We want people to move through spaces, and we want people to be outside, being active, enjoying the outdoors and getting that relief. But it's going to be about you keep moving and keep to small groups, family members, and otherwise that 6 feet of physical distancing.
Thank you. And another question from Suzanne Spencer with Fox 6. And she asks, how will barricades play a role in designating new pedestrian space at these parks? And also, is it just the 3 parks starting today?
Yeah, I'm happy to answer that. Yeah, so we do have barricades in place at those 3 locations, and they will also be signed with some instruction on why they're there. Because if you aren't aware of the Active Street Initiative, it could catch you off guard if that's normally a route you travel. So barricades do provide an essential role in this, and we have our county staff monitoring those locations and those barricades to make sure that they're in place through our dedicated staff to those areas. Likewise, the city will start rolling out their locations over the next few weeks, and they will have a similar approach and be monitoring those barricaded intersections as well.
Great, thank you. Okay, so I don't see any questions, any additional questions on active streets at the moment. So I believe we do have Dr. Bhattacharya from the City of Milwaukee Health Department with us. And Dr. Bhattacharya is the laboratory director and also special deputy health commissioner at the health department, who's going to tell us a little bit about the Centers for Disease Control. Please go ahead, Dr. Bhattacharya.
Hey, thank you, Brian. Thanks for having me. And it's our great pleasure to let you know that City of Milwaukee Health Department Laboratory, as well as the health department, as we are continuously working on the COVID-19, we were able to access CDC headquarters and request additional support for the case investigation and ongoing outbreak support. So a little bit of a background, as of May 4th this year, CDC has deployed over 40 field team for the additional support to all the state, local public health agencies. And as they continue to do the deployment, the primary focus is epidemiology, community mitigation, infection control, infection prevention, and laboratory needs and support. And primarily for the outbreaks, those who are in high risk situation, for example, long-term care facilities, correctional facilities. And these folks, the CDC headquarter personnel, are helping closely working with the state, local public health agencies to address their needs. For City of Milwaukee, this is our second opportunity that as of May 4th, we had a CDC team of 3 who came here. That includes an epidemiologist who is specialized in the emergency response and the recovery area, and a science officer who is overall public health support, as well as an account manager who is experts in the information technology and the data analysis. So CDC team is collaborating with our health department team to support the contact tracing, outbreak investigation, and the data analysis, given that to support for the decision-driven public health actions. So a little bit of an update for the contact tracing situation. Currently, we have 54 individuals who are involved in the case management and contact tracing. As you can imagine, the increasing number of cases. A little bit of a background that we started the pandemic response with only 6 MHD staff who are doing fabulous work, but as you can imagine, the workload was increasing tremendously. So having the CDC people here definitely, helping. Just this is the first week of them getting ready and working already very closely with the staff. We're also planning to train 30 MPS nurses to assist us in contact tracing as of next week. And that will help us ramping up the capacity for the coming week. And a little bit of a statistics here that in the past week itself, City of Milwaukee Health Department staff were very proud of. They had 226 confirmed case investigation in action. And eventually 22 of those were handled by the local health department, as well as 280 of those were by the state. And to add into this whole team of 3, as of tomorrow, we'll be receiving another team of 5. Those are very special experts helping us, including the meat packaging plant and the meat processing plant. As you know that we have a significant outbreak going on those areas. So some of those progress so far, if I may add into that they are already helping in our strategic planning for reorganizing the incident command structure and the workforce need assessment, which is one of the key things as increasing or building the quality assurance in our process. They are also helping us to looking into the tracking the cases and public health risk mitigation. Tremendously helping in advancing the training, which is an improvement areas, as well as working with the Wisconsin DHS technology as their proposed solution for the COVID investigation speed up. So all of those are really at our favor, and having additional team coming tomorrow, hopefully we can focus on our additional outbreak that's going on with Milwaukee County. So that team will also work very closely with state of Wisconsin DHS. Thank you. I can take any question that if you have.
Thank you. And do we have any questions for Dr. Bhattacharya? I'm not seeing any at the moment. So I believe Director Francis might have some additional information about other parks where active streets will be set up.
Yeah, actually, this is more general park updates, if I could just share a few of those. So just quickly an update on the beer garden. So we wanted to make everyone aware that unfortunately, this is not the news we wanted to share, but the first leg of both traveling beer garden tours this year, the Roll Out the Barrel and the Pass Me a Pint tour, have been canceled. They were slated to start next week at Juneau Park and Wisconsin Avenue Park. So the next leg is scheduled to start on June 3rd. We'll expect to decide on whether that leg will move ahead or not around Memorial Day. So fingers crossed on that one. Additionally, we're developing safe start plans for our permanent beer gardens that we operate, like at South Shore Terrace, the Whitnell Beer Garden, and the Vine Humboldt, to adjust operations, which will allow us to reopen when the time is right, and we can keep our staff and the public safe. Our partners at the Landing and Estabrook Beer Garden are also creating similar plans, and opening dates for our permanent beer garden locations remain to be determined. Dog parks also remain closed at this time, but we are working on plans to open them up safely, and we're hoping that we can open them before the end of the month. So we'll have more news on that before too long. I want to remind everyone that other parks facilities currently remain closed, and those include playgrounds, fitness equipment stations, tennis and basketball courts, and rental and indoor facilities. We're really happy to let everyone know that McKinley Marina is launching today with a soft opening. Like I mentioned last week, there will be restricted access to facilities, but we're really, really happy that we can give access to those boat slips. All county disc golf courses will also be opening up tomorrow, so that's a bright spot. We've had a lot of inquiries about that and are excited to see people out on the disc golf courses. So there will be slightly different rules to keep everyone safe, but they'll be easy to follow and people should enjoy playing disc golf like they regularly do. Just a reminder that all county golf courses remain open. And then I also want to just kind of wrap up here with a few reminders on safe park use. And these are things that you've heard before, but we want to just emphasize them. They're really important in terms of protecting yourself and your fellow park users. So just if you can remember to respect everyone around you and maintain good physical distancing practices with that 6 feet minimum for those outside of your family. We really recommend strongly that you wear a face mask when you're using public park spaces to protect yourself again and those around you. Plan ahead. This isn't news, but bathrooms and indoor amenities remain closed at this time. So just make plans so you are aware of those needs. We encourage you to walk to your neighborhood parks rather than driving, as the county executive mentioned. It's really important right now. Take advantage of the 15,000 acres of county parkland that we have and visit those parks that are close to your home. And if I can remind you also to take trash with you when you can. If you bring it into a park, it would really help us at that time if you can take it home with you. We're significantly understaffed compared to where we are normally this time of year because of the pandemic situation. So that makes a huge difference in keeping our parks clean for all the users. Just a couple more things. Parking restrictions remain in place along Lincoln Memorial Drive through this weekend and potentially beyond. Those are temporary, but that's an effort to keep congregating down from the lakefront and other busy locations. We're eager to continue opening facilities as it becomes safe to do so, and we're continuing to monitor guidance from the CDC and the state, our local public health officers, and other institutions that are providing great guidance for us at this time. So be safe this weekend, enjoy the parks close to your home, and take care of each other while you're outside having fun. Thanks again.
Thanks, Director Francis. So I see that Mayor Barrett has joined us, and so we can go to him for remarks. And I just want to acknowledge that there are several questions in the chat regarding parks, so we'll come back to those. in a moment, and also see a couple questions for Dr. B regarding the CDC. So Dr. B, if you want to take a look at those questions in the chat while we hear from Mayor Barrett. Please go ahead.
Thanks a lot, Brian, and thank you for all the work you've done. I understand you're going to be leaving these briefings, so I want to thank you for
everything
you've done. You've done a great job.
I appreciate it.
I came in at the end when Jen was talking about the Safe Streets program, and at this time when we are really facing some challenges, I think with people feeling more and more pent up, the city and the county have been able to work very well together. And I appreciate the work that Jen and her staff has been doing, the work that Jeff Polinsky and our staff have been doing to try to be creative and to give people more outlets and literally more outlets and more of an ability to use our park system, to use some of our city streets, and so that you can get out there and enjoy the nice weather, which we hope is here to stay now, and naturally be able to observe social distancing. Because I think there's been some experience for some people in some parts of our park system and other parts of our city where just the fact when people are coming out and the weather's nice, it makes it difficult to have that 6 foot difference, 6 foot separation. By having a program like this, and what we have actually done, this is something that both the county and the city have been working on for some time. We viewed this as a really good time to activate it in the hopes that we can make it a longer term program. But we thought, well, this is a great place to really launch it at a time when people want to get outside, when they feel pent up. And so let's take this opportunity that none of us want to be experiencing, and let's see if we can do something really good and positive for our residents as a result of that. So I look at it as being an experiment, and an experiment that we hope will be very, very successful and will allow people to, again, enjoy our community in a safer way. I also want to touch on, and I know you probably touched on this, a lot of excitement. I'm hearing a lot of people talking about the fact that we're going to have these new sites opening Monday on the north side and the south side. This really ramps up our efforts, and we want people to be cognizant of the ability now to get tested. So particularly for people who are in jobs where they're interfacing with the public a lot, please, please, please take advantage of this. Is at no cost. You can walk up, you can drive up, but come and get tested. I think everybody benefits the more people we have tested. So with that, I'll turn it back over to you, Brian.
Thanks, Mayor Barrett. And so we'll go back to questions now. We have several questions. The next one, I believe, is from Caressa, who is with the Wisconsin Bike Fed. And Caressa says, this is a great idea with the reckless driving issue we have in Milwaukee County. Will you consider utilizing local street only implementation? Of course, being mindful of community engagement to help show residents the benefits with low cost and rapid implementation of slow streets, active streets, limited through traffic facilities like partial street closures, traffic circles, and other diversions. So perhaps Dr. Francis, would you like to?
Yeah, so in terms of, I'm not quite sure, Caressa, what you're describing as utilizing local street only implementation. If you want to expand on that in the comments, I'll keep my eyes peeled here. But we are using local streets. The city in particular has identified local streets that are either adjacent to park spaces, adjacent to trails, good connective tissue between different parts of the city for residents. So local streets are definitely part of this. And there will be a website and some maps that follow up that identify sort of the full spectrum of pilot locations that are in this first phase, both for the city and the county. So I think that will address, that concern. But I think, these are temporary changes during the pandemic in response to the need for more space, and we'll see how they work. And the great thing is we can try out different locations as we need. And if they aren't working somewhere, they might fit really well somewhere else. So there's a nice level of flexibility that this initiative provides.
Thank you. The next question is from Hillary Mintz, who has a question about Grant Park. And I believe maybe there was an earlier street closure at Grant Park that's been for a little while, and she says that some neighbors are upset about the congestion with people having to park on street and walk in, and they feel social distancing is not happening. What can be done about this?
Sure, I'm happy to field that one too. So yeah, we definitely have had some parking restrictions put in place in some of our busy locations along the lakefront and at Grant Park. That's been really important as a tool to help reduce crowding in those locations. And while it does in some places displace parking to other locations, it is in fact having a minimizing impact on the amount of people we're seeing congregating. So there isn't an ideal solution to this situation at this point, but we are looking at the best practices that we can implement in the moment to keep the public safe. And so these are fluid choices; they're not permanent. But at this point in time, it is providing a level of safety to our community to keep the congregating down in those levels. Social distancing is tough because we really rely on people to self-monitor and self-regulate and practice good social distancing. And it's so critical that we're all playing a role in that. You're going to see people not social distancing when they shouldn't be. And we need to help keep getting the word out about why it's so important. We have our park rangers who are out circulating throughout all of our county parks, our system, helping educate people about the reasons for social distancing, why it's needed. I know that the sheriff's office and MPD are also supporting those messages. It's very challenging.